I have the pleasure of coordinating what I believe to be a panel that is literally at the crux of the big bet of the medium and long term, which is how we can basically innovate and capture the added value and the fruits of technology early on, capitalizing on the discussions we've had so far. And the way we have designed this discussion is to start with a few broader remarks with Vasily, who is joining us for the first time on the stage of Fortune Greece. He is currently one of the most senior advisors the country has on AI matters, despite his youth. And he's honoring us with his presence. He has traveled abroad with the Prime Minister, to whom he serves as one of his closest advisors on technology and AI. And we will start with a few broader remarks, and then we will zoom in again in the field we studied today, which is healthcare, of course, to see the bridges of collaboration in innovation, private and public partnerships, what the private sector can do to catalyze further innovation, but also how we can help shape a more advantageous environment for innovation to flourish, for AI to deliver on matters of sustainability, growth, and with multipliers for health span, not just lifespan, as we've been studying today. With that promise, I'm very briefly introducing a very frequent discussant on the panels of Fortune Greece, Dr. Kavita Patel, who heads Roche. Vasily, I mentioned. Lilian Venetia-Vilderidi serves as the Secretary General for Healthcare, and she is effectively, by mandate and by portfolio, the most key person on matters of infrastructure, public-private partnerships, and the future of reforms in healthcare, including the RRF dimension, which we all know is pivotal because it's finishing at the same time, but we also have to implement, and we have to have a plan for the post-RRF environment. And Thanasi Papapostolou, who has been, as a family, the catalyst for healthcare technology in Greece for more than 100 years, 112 in fact today, and he is indeed a key partner of Fortune, and we're delighted to have you with us, Thanasi, who heads a number of elements in this family firm that has transformed technology and healthcare in Greece. Without further ado, Vasily, if, as promised, we can, let's start with the broad picture, which has suddenly Greece at the forefront of discussions on AI. We had OpenAI coming to Greece and signing a strategic memorandum. We saw pictures of you in India, together with the Secretary General for Foresight, Yanni Mastroioriou, who honored us in the previous panel. I think he's still around, and the Prime Minister in what was, I understand, one of the most dynamic discussions on the most game-changing technology and transformative, let's say, force of our time, probably. What's happening, and how is Greece actually gaining this new dimension in its international policy standing, but also as part of global innovation in that field?
Good afternoon, everyone. A pleasure to be here today. Pablo, thank you for the invitation, and to Fortune
for joining us, and I know how difficult
me.
It was because it's a hectic period
thank you, appreciate it.
So
healthcare is not my vertical, although when you're in AI, I guess every vertical is your vertical in some capacity. But I want to give you three broader points as to what we're doing in government when it comes to artificial intelligence, which I think ties into the broader discussion you're having today, and I think affects you as business people as well. So I'm going to talk about data infrastructure, and then I'm going to talk about how we see AI from the center of government when it comes to both the application layer, the service layer, but also partnerships we want to have as a country to bring in the best and the brightest. So the data point, which is very important when it comes to healthcare. What we've done over the past 1 year with the Ministry of Digital Governance is make sure that each individual ministry is designated a DPO, but not as in a person who silos the data and protects the data, but someone who can administer the data, share it more broadly with the public sector, and at the end of the day, make it available with you. Now, I will say that it comes down to each individual ministry's leadership to make sure that this person exists and does their job. Our kind of purview is to monitor and make sure that happens. Within the next 1 or 2 months, the Ministry of Digital Governance will also be coming out with a platform that will be accessible to the public, businesses alike, Because we went through a data classification process, and through that platform, businesses will also be able to access publicly available data, which can be used both in services, products, and applications. And as time goes by, this is going to become even bigger. The second part is infrastructure. As you all probably know, for AI to run, you need the infrastructure to support it. Now, the infrastructure stack is huge. And it's global, and there's this huge debate now in the European Union along the lines of digital sovereignty and what it actually means for a country. I want to make sure that you understand that we as a country understand digital sovereignty as what is the best possible available technology out there, how can Greece procure it, whether that is of European or American origin. So what we've been trying to do is at the same time, start a series of partnerships with big American hyperscalers, where they can have here their data centers, where we can have access to their cloud capacity, right? But at the same time, we've been working with the European Union to develop our own infrastructure as well. Now, obviously, this is a slower process because in contradiction...
If I slow you down on this is pivotal, and I don't think it has been as clear as you stated on this stage. That is that we are trying to remain independent and capable and just accelerate that with the right partnerships with the digital colossus globally, building capacity as we go along. So effectively you see Greece leading on the EU level through this process by building its own independent infrastructure, digital sovereignty on what is, let's say, the new trend, the cutting edge of the field, and you are ambitious to lead through that bridge. So bridge of added value through the United States, plus an EU-level leadership by Greece, if I understand it correctly.
Yeah, because there's a fine line between idealism and naivety, right? And when you're saying that you want to create the whole AI stack within the European Union, it's not something that happens within days, weeks, or months, not even a year. It happens over years. And even then, the supply chain is so globalized that you won't be able to insource everything in the European Union. And at the same time, as a country, we understand that being close with the United States is not only a matter that has geopolitical connotations as well, but we as policymakers, and at least that is my job, is what is the best the best available possible technology best out there. And this is, in some cases, American technology. And the last part that we see is the AI layer, the products and the services and the big partnerships. As Pablo said, we recently signed a partnership with OpenAI to introduce AI in education and support the local startup ecosystem. I think the biggest disruption that artificial intelligence is going to bring in the market and in labor is not just the whole discussion around how many people are going to be displaced, who's going to lose their jobs, the new jobs that are going to be created. I think the biggest disruption is going to create is we're going to see who is good at their job and who isn't. AI gives us governments an opportunity to create products and services at a fraction of a cost, at a fraction of a time. And the more this idea is being standardized and understood within government, we're going to see, different amounts of public contracts being out there, right? Because that is the promise of this technology, that you won't need to spend so much time and so much money on technology that can be developed way easier, and may I point out, without intermediaries. At the same time, what we're trying to do through our office is develop G2D and G2F relationships, which is something that hasn't been done before, which is government to developers and government to founders directly. These are the people who build. These are the people that we are interested to have closer. And we want to introduce a new kind of philosophy in government that, working with startups and along startups is the way to go.
Brilliant. So what I understand is that you have an innovation bypass in some ways, that you will do an unmediated bridge with the government to catalyze innovation. You will build the infrastructure, realizing that this is a long-term or at least mid to long-term process. You will bring the key allies in. And what I also kept from your introductory remarks, Vasily, is that it's clear that you will invest in the tech and innovative ecosystem, both in terms of shaping the milieu, shaping the environment and the infrastructure, but also giving the right technological bridges, the right allies, bringing them in and allowing Greek innovation to be at the forefront. And I choose to close this first ping pong we had with the word innovation because I'll come to you, Kavita, because you combine this view of seeing things from abroad, from a colossus of the field, listening to what we're trying to do in transforming the landscape for innovation and building capacities. Vasily may have said that it's not his vertical, but when he speaks to working with founders, in fact, Greece's second most important pillar is biotech now in the eyes of the international investors, an endeavor recently highlighted it, and I think it's coming along. Greece is becoming a hub, and I do want your first comments on innovation from both the insider outsider view that you combine and the global trends you see as Roche.
First, thank you so much for having me here and for the opportunity to engage in this discussion with this brilliant panel. I do believe that for innovative companies like ours, innovative medicine is the heart of everything we do. So first, it starts with the mindset of how we think about innovative medicine. Traditionally, innovative medicines are seen as a burden to the system or a cost that's imposed to the system or a social good. I would invite us to think about innovative medicines as it's worth it. It's worth the investment. And let me tell you why. First and foremost, we know that with innovative medicines comes healthier lives. With healthier lives, you see an increase in productivity, which then has an impact on society and GDP. A most recent study that was done by Υγεία showed that investment in health, €1, led to a return of €4. We know that pharmaceutical innovation in high-income countries has led to 2/3 of the increase in life expectancy. So this goes without saying that innovation as medicine is critical in order for us to have the healthy society and also for us to have a prosperous economy. The second point that I would like to make is invite us to think about the life science industry and the pharmaceutical sector that focuses on innovation and innovation medicine. Many companies, such as Roche, are leading in the space of AI and digital technology. We look at AI and accelerating AI as it relates to early drug discovery. Today, about 10,000 some molecules are studied in the bench in early research, and eventually only one will make it to patients. AI gives us an opportunity to change that equation and accelerate the number of medicines that we can bring to patients faster, because ultimately that is our mission. How do we discover medicines in areas of the greatest unmet need so we can help citizens around the world? And digital technology is a key component to that, right? So we think about digital technology not only in R&D, but also what it means for patients and patient care and enabling health equity. I will focus on R&D for a second, because I do think this is an opportunity where we in Greece could think of the life science industry differently. However, a sustainable environment needs to be created in order for us to make progress in this area.
So I understand that some reforms may be encouraged at some stage.
Yes,
we can talk about in the second round. And Lilian, for a very specific reason, which you will understand, I will ask for your permission to start with Thanasi and close with you the first round, because you are the enabler, if you want, the maestro of everything we've heard so far. And you know why. Θανάση, επειδή αυτό το case είναι πάρα πολύ σημαντικό για την Ελλάδα και απευθυνόμαστε σε ένα ελληνικό κοινό, σε συμφωνία με την Καβίτα, θα το κάνουμε αυτό το κομμάτι στα ελληνικά, γιατί ξεκινώντας από τη γέφυρα με το innovation, την ιατρική τεχνολογία, υπάρχει μια ευκαιρία, αν κάνουμε περισσότερα ιδιωτικός και δημόσιος τομέας μαζί, και θα δεις κιόλας γιατί έχω αφήσει την κυρία Μπελτερίδη να τοποθετεί μετά, μπορούμε να πετύχουμε πολλά για τον τόπο μας και αυτά που είπαμε να γίνουν πράξη με ένα πολύ δυνατό παράδειγμα. Οπότε, Θανάση, ευχαριστούμε πάρα πολύ που είσαι κοντά μας. Δώσε μας λίγο αυτή την ιδέα. Σε συνδυασμό φυσικά με το ευρύτερο comment για αυτά που συζητάμε.
Ευχαριστώ πολύ για την πρόσκληση και τη συμμετοχή στο πάνελ. Είναι πράγματι μια μοναδική ευκαιρία σήμερα για την Ελλάδα όταν μιλάμε για longevity και έχουμε, για παράδειγμα, ένα μεγάλο αριθμό καρκινοπαθών. Έτσι. Οι περισσότεροι θάνατοι σήμερα είναι ογκολογικοί, καρκίνος και καρδιακιακά. Έτσι. Δεν έχουμε αυτή τη στιγμή και δεν υπάρχει στην νοτιοανατολική Ευρώπη μία μονάδα πρωτονίων, θεραπεία με πρωτόνια. Έχουμε κάνει σαν εταιρεία μια συνεργασία και υποστηρίζουμε την προσπάθεια του Πανεπιστημίου Αθηνών να μπορέσει να μπει μια μονάδα θεραπείας πρωτονίων κάπου στην Ελλάδα, σε ένα ελληνικό νοσοκομείο, πανεπιστήμιο.
Μας εξηγείς λίγο παραπάνω το core της παρατήρησης. Δηλαδή,
Ναι.
τι game changing στοιχείο έχει αυτή?
Όπως γνωρίζουμε όλοι, η ακτινοθεραπεία γίνεται κυρίως με γραμμικούς επιταχυντές, όμως η κορονίδα της ακτινοθεραπείας, η πιο νέα τεχνολογία και αυτή που εξασφαλίζει την καλύτερη ποιότητα ζωής, αλλά και σαν ένα όπλο έξτρα μπορεί να κάνει τον καρκίνο ως μια πιο μακροχρόνια ασθένεια, γιατί αυτός είναι ο στόχος. Μπορεί σε κάποιες περιπτώσεις ο καρκίνος να μην θεραπεύεται, ο στόχος όμως είναι να γίνει μια μακροχρόνια ασθένεια. Έτσι λοιπόν γίνεται με ένα ακόμα όπλο, τα πρωτόνια, το οποίο μπορεί να, καταρχήν για τα παιδιά είναι το α και το ω, όταν όσο πιο νέος είσαι δεν πρέπει να ακτινοβολείσαι, γιατί τα πρωτόνια είναι particles, δεν είναι ακτίνες χ, δεν επιβαρύνουν τον οργανισμό και επίσης είναι πολύ πιο εστιασμένα. Δηλαδή μπορώ να χτυπήσω το μάτι χωρίς να χτυπήσω από πίσω τον εγκέφαλο. Άρα συνεπώς γίνεται μια θεραπεία που δεν έχει επιβάρυνση μελλοντική στον ασθενή. Άρα είναι...
Ως Παπαποστόλου Medical έχετε πρόσβαση σε κάποιο, θα μπορούσε να είναι η πρώτη τέτοια επένδυση, να τη γεφυρώσετε για την Ελλάδα?
Αντιπροσωπεύουμε στην Ελλάδα την εταιρεία IBA, που είναι ευρωπαϊκή εταιρεία και είναι η εταιρεία με τις οποίες τα μηχανήματα γίνονται οι μισές θεραπείες πρώτων θεραπεία στον κόσμο. Και έχουμε κάνει μια κίνηση, βοηθάμε το Πανεπιστήμιο Αθηνών. Θα πρέπει να βγει επιτέλους, νομίζω έχουν γίνει διαδικασίες, αλλά κάπου είναι στη μέση από το Υπουργείο Υγείας, να βγει επίσημα η τιμή αποζημίωσης της πρώτων θεραπείας για να μπορέσει να ξεκινήσει να γίνει μια επένδυση.
Που θα καθιστούσε και την Ελλάδα, καταλαβαίνω, και σαν πόλο έλξης για θεραπεία και σημείο λύτρωσης ιατρικής με βάση την επιστήμη αυτή τη στιγμή. Δηλαδή να ανοίξουμε ουσιαστικά μια νέα εποχή για την υγεία σαν τόπος πρωτοπορίας σε αυτή την πολύ ιδιαίτερη θεραπεία.
Πολύ σωστά. Όπως είπα,
κεφαλοποιεί, καταλαβαίνω, και όλες αυτές τις τεχνολογίες που συζητάμε.
Είναι τώρα η ευκαιρία για την Ελλάδα, γιατί δεν υπάρχει αυτή τη στιγμή στην νότιο-ανατολική Ευρώπη και στα Βαλκάνια γενικότερα μια μονάδα πρωτονίων. Υπάρχει στην Ιταλία, υπάρχει στη Γαλλία, Γερμανία, πιο βόρεια, ναι, αλλά στο δικό μας το region δεν υπάρχει μια τέτοια μονάδα. Αν την ξεκινήσουμε πρώτη, θα είμαστε και το reference point για την νοτιοανατολική Ευρώπη. Είναι σίγουρα όλα αυτά που γίνονται πολύ σωστά με την προληπτική ιατρική για την υγεία από το Υπουργείο και όλες αυτές τις προσπάθειες, αλλά σημαντικό είναι επίσης να έρχονται χρήματα, να μπορούμε να προσελκύσουμε, να δώσουμε την δυνατότητα να μπει καινοτομία στην Ελλάδα και να προσελκύσουμε ασθενείς από το εξωτερικό. Γιατί μια τέτοια μονάδα δεν θα είναι μόνο για την Ελλάδα, θα είναι για όλη την περιοχή. Και καθώς σίγουρα έχουμε τους πολύ καλούς γιατρούς και γενικά όλος ο κόσμος εμπιστεύεται τους Έλληνες γιατρούς, είναι μια μοναδική ευκαιρία να βάλουμε καινοτόμες τεχνολογίες και να ξεκινήσουμε πριν από τους γείτονες.
Στο χάρτη των συμμαχιών, Θανάση, για να περάσω στην κυρία Γενική Γραμματέα, στη Λίλιαν, είναι πολύ σημαντικό, καταλαβαίνω, η συνεργασία με τον ιδιωτικό τομέα, τον ακαδημαϊκό τομέα, τους partners από την ιδιωτική υγεία, αλλά και το δημόσιο τομέα. Άρα ουσιαστικά θα πρέπει να είναι ένα εθνικό στίχημα για να πετύχει, και καταλαβαίνω ότι αυτό που σήμερα σας δίνει τη σιγουριά να επενδύσετε σε αυτό αποφασιστικά είναι η ευρωπαϊκή διάσταση, αλλά και η ελληνική υποδομική διάσταση τεχνολογίας, που αυτή τη στιγμή μπορεί να υποστηρίξει αυτή την επένδυση.
Έτσι είναι. Πολύ σωστά.
Είναι δηλαδή αυτή τη στιγμή όλα τα άστρα σχεδόν aligned για να κάνει η Ελλάδα κάτι σημαντικό. Χάρη και στη δουλειά που έχει κάνει το Υπουργείο όλα αυτά τα χρόνια.
Πολύ σωστά. Έτσι είναι. Και υπάρχουν οι δυνατότητες, είναι και στη Βόρεια Ελλάδα και στο νοσοκομείο Παπαγεωργίου, αλλά και στο Αττικό νοσοκομείο, που είναι δύο μεγάλα νοσοκομεία που έχουν τις υποδομές, που έχουν όλο το infrastructure και μπορεί να γίνει εκεί. Αλλά φυσικά μπορεί να γίνει και ιδιωτικά. Δεν απαγορεύεται. Και αυτό θα είναι ένα σημείο σημαντικό για την Ελλάδα.
And in your second remarks, Thanasi, if you can also introduce some other technologies that can bring Hellenic healthcare, Greek healthcare at the forefront, like you said, outside in all the discussions we had.
Well,
but keep them for your second remarks, because
okay.
I want to pass to Lilian with that note. And I don't know if you prefer to speak in Greek or English. Ό,τι προτιμάς, entirely up to you. Έχει η καβίτα μετάφραση, άρα είναι...
Okay. Ωραία.
So the question remains that παραμένει ερώτηση, ιδιωτικός δημόσιος τομέας, συνεργασία, καινοτομία, πώς μπορούμε να το κάνουμε accelerate? Έχουν γίνει πάρα πολλά, υπάρχει ένα τρομερό footprint αποτελεσματικότητας. Τι κάνουμε από εδώ και πέρα στο κομμάτι αυτό?
Να ευχαριστήσω και εγώ για την ιδιαίτερα τιμητική πρόσκληση. Και να ξεκινήσω λέγοντας ότι η καινοτομία πραγματικά δεν πρέπει να αντιμετωπίζεται ως ένα πρόσθετο κόστος, αλλά ως μια μοναδική ευκαιρία να αναδιοργανωθεί το σύστημα και να γίνουν direct τα resources που έχουμε σε πράγματα τα οποία είναι μετρήσιμα, που το σύστημα τα έχει ανάγκη μετά την επεξεργασία των δεδομένων. Άρα λοιπόν να κάνουμε στοχευμένη πολιτική, η οποία είναι evidence-based. Άρα συμφωνούμε 100% και στο δικό σας το σχόλιο. Τώρα από εκεί και πέρα, επειδή έγινε και θέμα για την αύξηση του προσδόκιμου ζωής και όντως η αλήθεια είναι ότι πολλές φορές το βλέπουν ως και αντιμετωπίζεται ως μια επιβάρυνση στα ασφαλιστικά ταμεία και στα συστήματα υγείας. Παρ' όλα αυτά, εδώ να πούμε ότι ανοίγει και μια ευκαιρία, η οποία είναι η πρόληψη, το preventive medicine συνολικότερα, η έγκαιρη διάγνωση, όπως βεβαίως η εξατομικευμένη φροντίδα, αλλά και η νέα μοντέλα παροχής υπηρεσιών υγείας, τα οποία είναι κυρίως εξνοσοκομιακά, δηλαδή ένα focus στο outpatient, κατοίκον περίθαλψη, τηλεϊατρική. Άρα λοιπόν αυτά είναι εργαλεία τα οποία και βελτιώνουν την εμπειρία του ασθενή και την ποιότητα της ζωής του. Γιατί το θέμα δεν είναι μόνο να ζούμε περισσότερα χρόνια, αλλά να ζούμε περισσότερα χρόνια με υγεία. Άρα λοιπόν εκεί θεωρώ ότι η καινοτομία τα επόμενα χρόνια θα εστιάσει και θα φύγουμε αμιγώς από τη θεραπεία και θα πάμε και στην αγραμματοσύνη και στην πρόληψη και σε αυτά τα συστήματα. Τώρα, συζητώντας για τις συμπράξεις δημοσίου ιδιωτικού τομέα, οι οποίες όντως όλο ένα και περισσότερο είναι επιβλημμένες δεδομένων και των πόρων των συγκεκριμένων που έχουμε για την υγεία. Το πιο βασικό, και θα ξεκινούσα από αυτό, είναι η αξιολόγηση των δεδομένων. Έχουμε βάσεις δεδομένων, συστήματα πληροφορικής τα οποία είναι solid, έτσι ώστε σε πρώτη φάση να μπορούμε να μετρήσουμε. Και αυτό είναι μια πολύ μεγάλη προσπάθεια που γίνεται στο Υπουργείο Υγείας. Και τι εννοώ? Αν κάτι δεν μπορείς να το μετρήσεις, δεν μπορείς να το αξιολογήσεις, δεν μπορείς να το διορθώσεις, ούτε να επαναξιολογήσεις μετά την δουλειά που έχεις κάνει. Άρα λοιπόν, το πρώτο βήμα είναι αυτό. Πάμε με στοχευμένες πολιτικές. Αυτό το βλέπουμε τόσο στην κατανομή του προσωπικού, στην επιλογή των υποδομών που έχουν ενταχθεί στο Ταμείο Ανάκαμψης, αλλά και σε όλα τα επενδυτικά εργαλεία. Και εκεί μπορούμε ακριβώς και να εντοπίσουμε πού χρειαζόμαστε τη βοήθεια, τη τεχνογνωσία του ιδιωτικού τομέα για να κάνουμε ακόμα καλύτερο το σύστημα και να πάμε στοχευμένα. Άρα λοιπόν, αν θα έπρεπε με μία λέξη να πω ποιο είναι το βασικό συστατικό μιας επιτυχημένης εργασίας δημοσίου ιδιωτικού τομέα, θα έλεγα ότι είναι η ξεκάθαρη κατανομή ρόλων. Δηλαδή, το κράτος έχει την υποχρέωση να θέσει ένα σαφές θεσμικό πλαίσιο, να εξασφαλίσει τη σταθερότητα και να κάνει επένδυση σε κρίσιμες υποδομές εκεί όπου πραγματικά έχει εντοπιστεί η ανάγκη για το σύστημα. Από την άλλη βεβαίως πλευρά, ο ιδιωτικός τομέας φέρνει τεχνογνωσία, φέρνει ταχύτητα στην υλοποίηση των έργων, πέρα βεβαίως από τα επενδυτικά κεφάλαια. Και αν τώρα η χρηματοδότηση αυτή συνδεθεί με μετρήσιμα αποτελέσματα, τότε θα μπορούμε να πούμε ότι η επένδυση αυτή έχει και οικονομικό και κοινωνικό αντίκτυπο και επηρεάζει στην ουσία τις υπηρεσίες που λαμβάνει ο ασθενής.
Συνθέτοντας αυτά που είπατε, and I promise now that I'll switch to English, and the last round will be in English, is from what I codified, Lillian, should the private sector build a coalition and have an evidence-based proposal and a very good business plan that will save money for the state, promote healthcare in Greece and attract international patients, and build a partnership of innovation from the private sector driven and with, let's say, robust private investment, you will be allies and partners to this as much as you can, the same way that you accept the congratulations and the, let's say, encouragement to continue doing the reforms that have allowed such thoughts to flourish in the private sector. Would that be a correct, let's say, engulfment of what you just said?
100%.
Brilliant.
Και μάλιστα, αν επιτρέπει ο χρόνος, μπορώ
We
να...
have 10 more minutes than you see there. Not much more, not much less.
Okay. Ένα πολύ μικρό και χαρακτηριστικό παράδειγμα σε αυτό, επειδή αναφέρατε και τις θεραπείες πρωτονίων, είναι ακριβώς αυτός που είπα για το θεσμικό πλαίσιο και τη σταθερότητα. Άρα λοιπόν, το Υπουργείο, όταν το Πανεπιστήμιο ενδιαφέρθηκε γι' αυτό, θέσαμε τους όρους και τις προϋποθέσεις. Είναι κάτι το οποίο δεν υπήρχε με τη βοήθεια του Κεντρικού Συμβουλίου Υγείας. Άρα λοιπόν, αυτό είναι το πρώτο βήμα και βεβαίως οτιδήποτε έρχεται τεκμηριωμένο με ένα συγκεκριμένο σχεδιασμό, αλλά και με μια πρόβλεψη του αποτυπώματος το οποίο θα έχει, βεβαίως είναι κάτι το οποίο και το προωθούμε και το επιζητούμε.
I have a surprise for you as flows goes. Thanasi, comments on healthcare technology that we should watch at in the post-RRF environment. I will come to Kavita and Lilian to see the urgency of transforming and continuing reforms and partnerships to deal with the post-RRF environment. And Vasily, be prepared for a quick ping-pong in the finale that will go broader, but at the same time it will have the skills necessary for the success of what you described in the map. Because this seems to be the key source that will unite everything we're discussing. How can we be AI ready if we don't have the skills to be AI ready? So, Thanasi, what's missing?
I think AI also can give a lot of information to the government, data, a lot of data. Because if you implement an AI in radiology, let's say, or in CT, then you can get results. You can get how many scans you did, how many were diagnosed with this disease, how many with the other disease, how many. So you can have the data to allocate the correct personnel to the diseases or to the checkup or to whatever is the need for the population. So AI definitely helps, and we need to enhance the adaptability of AI in the Greek hospitals.
And Thanasi, you mentioned that there are some technologies like scanning for heart and all these things that we can make a technological leap to have more, let's say, compounded, innovative offering in the both preventive and therapeutic angles on everything we're discussing. So since you are in some ways, the godfather of medical technology in Greece for more than 100 years, and not many people can say that in any sector of the economy, what we should look at in highlights?
As said, we have good doctors and we have good professors. So these doctors want to have the tools, but the system is very slow. They cannot get the right technology right at the moment of innovation. So we need to have the certain procedures in regards of getting the equipment, high-tech innovative
in the procurement
equipment.
angle, but some examples very quickly.
Yeah, there is
what are you referring to?
Today there is a CT scanner that can do one full heart scan in one heartbeat. So with a big coverage.
Wow.
And
so you're saving more than 10-15 minutes per exam.
You get yes, and this
and probably you cut the cost because more people can be checked.
Only with a dose that you can get in a mammography exam. So can you imagine to have a CT cardiovascular exam with a dose of a breast exam, and in 1 second you can have 3 millimeter slices to see the minor Stephaniakia. Yeah. So it's but this technology costs 2.5 million euro. So how can you have this technology in the public, or how can if I go to let's say in the private sector they want to have this technology, they need to apply for CT permit, which is now it's closed. It's very rare to find a city permit to install. Then you have an obligation to accept the OP price.
So if I can codify this, Thanasi, what you're basically saying is that there is a lot of new tech that we need to find ways, even with the pilot, to prove how they accelerate, perform, save money over time.
Exactly.
So some good pilots, like you're trying with the Proton, for innovation to prove its fruits and be economically viable.
Exactly. Yes. So and we need to have the infrastructure to be able to adapt.
But we agreed that infrastructure is going in the right direction. Don't change that last minute because the whole discussion will be upturned. Coming back to you, Kavita, a private sector view before I come to Lilian on what's changing now. We're going outside the RF environment. We've heard of all the great reforms that are happening. You've heard the mindset, and you've seen it in part, in effect, about PPPs and all that. And this is something that you have raised since the first day we met, on and off the stage. How optimistic are you? What we can do more? How we can work together? Let's keep a few ideas here.
Sure. So first, I'd like to ground us in terms of where we are in the pharmaceutical sector, right? I think that currently we are in a state of significant burden to the industry as it relates to the clawback measure, which we know, which was introduced at the time of the economic crisis. And now, post-RRF, I think it is really important that we move from a place of, trying to survival, to a place of being competitive. So Greece now has the opportunity to be competitive. However, reforms need to happen with great speed and acceleration. If you think about pharmaceutical companies and multinational companies, they have choices to make. They have choices to make in terms of where they will introduce the innovative medicines in an environment that is sustainable and ensuring that we will enable access to patients. And we have choices to make in terms of where we place future investments as it relates to AI as well as digital technology. And we just talked about earlier what the industry is doing and what the industry is capable of doing. So this is the current state of affairs, right? And so what are the solutions in how we can make progress and how we can together make Greece more competitive? First and foremost, we need to radically change the pharmaceutical policy so that there's adequate funding coming to innovative medicines. We also need to think about and acknowledge that budgets are limited. There is a certain amount that we have, and we need to effectively think about how we value innovation, put in value-based pricing, use the data that the ministry is collecting, which I would acknowledge is great progress as it relates to electronic prescribing, having data to think about outcomes so we can effectively measure the value of these medicines and price them effectively. And last but not least, we need to ensure that there are incentives in place, first of all, a sustainable environment for industry to thrive, but also incentives in place to attract investment here over somewhere else. So what I mean by that is the country has introduced investment clawback. Research and development is an area where the industry very much can contribute. However, historically, most of that has gone to production. Production is important. How can we also acknowledge research and development and move that investment clawback to at least 50% of it coming to research and development, acknowledge that clinical trials that are happening in the country and the foreign sources that are being invested into the country to incorporate into the investment clawback. So these are some solutions that we could think about as we really try and make Greece competitive, because the window is closing, right? With the geopolitical tension and what is happening, we must accelerate with speed, because this window is closing and we don't want to be left behind here in Greece.
If I may codify, Kavita, then you're saying, let's, at the state level, realize that we need to improve even more the environment as fast as we can. And at the same time, you're saying to the private sector here, which is well represented in the room, we have an open door, we can be allies, let's do more now, let's innovate more within Greece, capitalizing on what Vasily and Lilian and the government is doing as much as we can, but to encourage further reform, proving we're doing a lot. Because if a sector is not doing a lot, it will not be on the mansion's, let's say, core focus. But if we do more on that sphere, the opportunities will be there to speak louder than our words. Exactly. So let's work more together. Yes. Kavita, this is a brilliant cue. Thank you so much for giving it to us. Lilian, back to you. It seems that we've done a lot. Now the bet is post-RRF sustainability of the system. And I want to also include a personal note. You've been instrumental yourself, transforming a big part of what was in the wider portfolio of healthcare. Is there a personal angle or bet you want to see being completed as well within the course of this mandate? So sustainability and what you see as Lilian.
You're right. The Resilience Fund offered a unique opportunity to the Greek healthcare system, as now we have projects amounting almost 1.5 billion, which have to do with the upgrade of all the digital systems of hospitals. I see Ms. Suma, who has been instrumental in this job. So it's not only that, it's the interoperability between across hospitals, 127 hospitals. It's the digital infrastructure of ambulatory care. It has been, of course, a useful tool, an extremely useful tool for both doctors and patients, which will be the electronic health record. And last but not least, the infrastructural upgrades. And I will connect the infrastructural upgrades with a point I made earlier on, which was about evidence-based and very targeted interventions. For example, yes, it's not only that we have 400 million which go towards upgrading the infrastructure of hospitals. 63 hospitals, almost half of them, the emergency units, are now being renovated based on the best practices internationally, both for swifter patient access, but also better organization within. This is a small example. So in everything, we put benchmarks, KPIs, specific business plans, which are output-oriented. And of course, what we opt for is for these things to come, stay, and for us to sustain them throughout the years. And one of the most important things which we should mention is that since 2019, the public spending on healthcare has increased indeed 100.3% from 2.3 billion from 4.2 to 8.4, and solely for hospitals and pharma through centralized procurement has increased from 2 to 4. So I mean, financing is there, but the most crucial point is that now we target resources, whatever they are, from infrastructure to even hirings in the NHS, where we need it the most. So the biggest challenge I think we have to face, and it will be a big success if we do manage by the end of next year to maintain, is to finally, in Greece as well, match the demand for health services provision with the supply. And then, once we do this, for example, with targeted hirings, with interoperability between the systems, with new outpatient services to cater for wherever we have shortages, which we're trying to do with the national telemedicine framework, then to work very closely with the private sector to cover our shortages, but very specifically and output-oriented.
What can I say? This is music to our ears. Πραγματικά λίγα λόγια, πολύ μουσική. Μπράβο, κύριε Γενικέ, that's amazing. Thanasi, I keep what the Secretary General highlighted, which is that we should finish this phase of reforms, the basic infrastructure, and immediately introduce new elements of technology. And Kavita, back to you, a new dynamism for innovation. And this is now the outsider stake, which is the following. What seems to be a connecting theme and an absence of is a healthcare innovation digital officer of sorts, like a Secretary General for Innovation within healthcare, where this amazing human capital that you've underlined, plus the medical technology expertise of companies like and leaders like Thanasis, who have done this for 112 years and are ready for the new era, and international giants like Roche that says, we want to do more in Greece. Now is the time. We want to push for it, but, let's do it fast and now, because with whom should I talk? How should we do it? So private sector and public sector seem to be missing this one link of a catalyst for innovation in healthcare, which can be one of this government's legacy moves now that the RRF finishes to have the private sector pumping the next phase of investment through this unique link, capitalizing the digital infrastructure, the healthcare know-how, the allies for innovation, global and national, and also for medtech. And medtech made in Greece is something that I'm sure Vasily has seen in that lens of the vertical, where the founders have a lot of healthcare insights, health tech, insurance tech. A number of firms are around the wider biotech and healthcare spheres, Vasily, aren't they, in Greece? And Endeavor has a specific pillar, and we're doing very well in this field.
Yeah, just briefly,
Please.
I think what Thanos said before is really important. The government operating system, the government OS, not just in Greece, right, but in general in Europe, is not built for the technology of 2026. Everything, especially public procurement, the process, the cost, the time, and so on, they were built for a post-World War II, 1970s, 1980s kind of world where transparency and scrutiny are the main values that those systems kind of take into account, which is important, obviously, in public procurement. But if you want to stay in pace with how technology is developing, you need to be updating those. Only in the past 1 or 2 months, we've had applications and services that have developed exponentially, where over the past 10 years, you would see them happening in a different timeline. So government is staying behind when it comes to procuring those systems because we don't have the much needed tools to do so. So point number one would be, and a lot of that framework is being shaped at the European level, is what can the government do to update its own operating system to be able to procure those?
And if we want to bring it home, some of us have Grok, some of us have ChatGPT on their phones. Just see that every month or so, maybe it has revised a new update. So this is what Vasily is coping with, and with the team, of course, and everyone at the state level. And this is what Kavita says, we need to be fast because, you're 5 revisions behind if you're not acting now. And this is what Thanasi is saying. Let's see how all this comes together on a business plan now to start investing and be part of this change. So what Lilian is saying, we're building the infrastructure so you all can do these things you're saying. So
the first one is this. The second one is, I think the bigger problem in Europe and in Greece is something you're noticing in the United States. Every conversation and every discussion in panels like this, I guess not this one, starts with, dangers and challenges around data leakage and GDPR and so on. Our problem is not data leakage, which again, these are of course important challenges. Our problem is the lack of access to input word, lack of access to data, lack of access to capital, lack of access to scaling, and so on and so on. So what we're trying to do at least is, again, build a pipeline directly with founders themselves, but also try to attract talent in government to develop those applications by ourselves. The Prime Minister has spoke about that. Over the past 1 year, we've created the dedicated delivery unit under the presidency of the government, which is the function that supports the Prime Minister, that comprises of software engineers, product managers, developers, and so on. These are people who came from the private sector. Thank God we convinced them to join us because a government at the same time cannot pay the market price for a developer or a software engineer. So we have a team of 10 people. It's an in-house delivery unit that works to create applications for the state itself. Now these are in-house applications. We're using them for ourselves for now because there's a huge factor of risk mitigation as well, right? But what we've managed to show over that 1 year that we've been using those applications is that you can do things at a fraction of a cost, at a fraction of a time, right? And this creates a layer of tech due diligence that it's much needed. It's much needed when you have big companies coming your way and suggesting X solution, which will take X amount of time and X amount of money. But at the same time, it's really important because we're now interacting with a lot of startups that have a lot of ideas. And what I tell most of them is, your first customer should not be the government. And this is important in the EU.
Why you had these good passes that say that we want to have a link with these guys as soon as possible and innovate together and shape the framework advantageously. So you can go back to the office and say, we had an open call from Roche that is globally viewing an opportunity here, but we need to work together. And from Papapostolou Medical that does this in a number of countries. And this is true, but we need to do it because you're doing it
I'll make sure
in a bypass, but we need to do it more circularly as well.
To finish off my point here is that what we're trying to communicate to the local ecosystem is that the building mentality that you're seeing across the Atlantic is not random, right? Obviously, there's a different framework there that supports innovation way more than it does in the EU. But what we're saying is we're here for you to support you. But your first thought when you're building a startup, right, in biotech and pharmatech and so on, should not be how do I partner with a government. This is a recipe for success. And I think more government officials should be speaking more about that in the open. We're here to support you any way we can, but they need to build their own business cycle and then see how partnership with the government can be viable.
2 notes, and you can comment whichever of the 2, but definitely skills. And we close with that, Vasily. In my opinion, from what I understand, since we have the human capital, we need to find a way to build the AI skills that will unlock a hyper growth, because I don't see either a pot of money, either a pot of people that can do it without this digital upskilling on AI skills that we seem to be needing. And because you've been around the world, it seems that younger populations adapt faster, and we have the challenge here that we are not necessarily the youngest population on the planet. So we have to have a transformative plan for upskilling in digital and AI skills. And the second remark I have is that there is a huge opportunity to bridge all these links more as we go down the road, this private-public sector. And it probably is the only chance for this acceleration to work. So I'm hoping that people will keep an open mind as we go down the line to replenish the gap from the no RRF era, no EU funds at that abundance that we had them, to mobilize the private sector to be the key ally of the vision you described.
My quick point on talent is on the private sector and then the government. On the private sector, I think especially what a lot of medium to small size businesses don't understand is that a subscription to a tool is not enough. You need to get that know-how internally. You need to get it in your people, and you need to get people in who have the know-how, right? That goes the same way with outsourcing work to consultants, because if the knowledge itself does not stay institutionally within the organization, then your company is not going to grow. The second point is about government. The 90s and the early 2000s were mostly governments were run by lawyers, and I'm saying that very cognizantly. My initial background is law, and then I did tech policy and computer science. But the 90s and the 20s where lawyers were winning in government, and now what we need is more data scientists. We need more engineers. We need more software developments, and so on and so on, right? And this is like a personal criticism as well. We need to create the right circumstances for these kind of people to come in, right? You need to be paying them better. You need to be providing more flexible hours, and you need to be giving them the purview and ownership that a builder has in order for them to come into government and build as much as possible.
We will build data centers. You will catalyze talent and have programs for upskilling. I saw you, Lilian. Please, one comment, and we'll close with this.
I wanted to stress the importance of education of health workforce when it comes to introducing new technologies. And I think this is a problem that with Mrs. Tuma we encountered quite a lot now that we're pursuing the digital upgrade of the whole infrastructure system of hospitals. So that's why I think it's very important to always keep in mind that new technology without the appropriate knowledge by handlers won't make the cut. Hence, even in the small projects that we are doing, from the upgrade by Vika, even from the QR code system in the emergency units, and the DRG system, which is now a big thing in hospitals, education of the people is one of the most crucial parameters that we should always take into account.
Well, headline, we have more work to do. These four people will work more together going down the line, and I hope that the teams remain in place. Thanasi, Lilian, Vasily, and Kavita, we are ever thankful as Fortune Greece having you at our stage for this amazing discussion. And I apologize to the other panels that we took a little bit more time, but you were unstoppable. Thank you, guys.
Thank you.
Thank you.